Hello everyone, this is Fatima and this is my Teach 1 assignment, and my topic is going to be about health data in Module 5, and I'm going to cover the question number 5 in part 2 in our assignment. And the question is, which month is most likely to have a diagnosis report? So we are talking about the month and diagnosis on this question. So first of all, before we move to the main question, I'm going to talk about what is a health data is. Health data. What is health data? Well, it refers to any information related to individual or population health status, medical history, diagnosis, treatment, and related healthcare activities. It encompasses data collected by healthcare professionals, patients, and health system to support medical care, research, public health, and policy decisions. And next, I'm going to talk about what is the health data categories are. So the health data categories are, this is what I got. There are 5, which the first one is the medical data. It's a subset of health data generated or used in professional medical contexts, including patient record, lab tests, and treatment plans. The second one is patient-generated health data created outside clinical settings by patients themselves, such as through mobile health apps or wearable devices. The third one is administrative and billing data, information related to healthcare service usage, billing, and insurance claims. Fourth, it's about population health data, which is about community or demographic group health outcomes and conditions to support public health surveillance and policy making. And the last one is the biomedical genomic data, which includes genetic and biomarker information, which supports personalized medicine and research. And so this was all about health data and a brief, explanation of that. So next, I'm going to talk about my main question number 5 in our assignment. And before we have to, I'm sure I didn't do it on my slideshow, but we need to import 3 files: ICD, claims, and patient ID spreadsheet files. We import them through our CSV files to task, and then import flat file. And my data is I pick claims. I create a claims database, and if you can see, I highlight them in yellow: DBO claim, DBO claims cleaned, and DBO ICD, patient ID, and TIM. So I made one TIM and also clean. These are for different questions, but I'm gonna focus on claims database today. So that's how I imported my files into my SQL server. Next, I'm going to talk about which one we are using on this question. So the main focus on this question is to use the columns in claims, the service from date or month, and then so basically we are most focusing on this columns from the claims file. So there's not much or changes on this one, because we had to change some other columns such as ICD, but not on this question, I believe. So what I did, I tried to calculate the month, which month of the year has the most diagnosis reported. So as you can see, I use select, and we select the month of the service and the month of diagnosis, and we have to use we have to count all the diagnoses of the total of 12 months of the year. And I drag the files, my all data from the claims, and then I group them by the month and service, and then all that goes towards the diagnosis, how many diagnoses we have, like the most of them. And once I executed this command, this is what I got. So the month of June has the highest diagnosis, which 1,554, and that's it. So this is the answer for that. And next I'm going to discuss my conclusion. So what is my conclusion? Health data is critically important because it underpins effective healthcare delivery. It also helps us in making clinical decisions. It makes the clinical research easier, and also uh, it helps with the public health strategies. So then I'm gonna say that SQL is very important in healthcare because it allows users to be more efficient. It makes the access to the health data easier, makes our health data more organized, and also we can do a better health data analysis. So that's it. Thank you. Thank you for watching. And if you have any question, you can text me or email me on the discussion board. Thank you.